This is Cancer Buzz. I'm Summer Johnson. On this episode, employee burnout in cancer care and changes program leaders are making to create resilient workplaces. Here's Tom Gallo, Executive Director of the Virginia Cancer Institute, on burnout unique to cancer care.
Burnout is a pretty large problem in cancer care. It's a very stressful profession, not just for the doctors, but for everyone who touches these patients and sees these patients all the time. The treatment plans for cancer patients are usually pretty intense, so the patients are coming to their physician office or cancer center on a frequent basis. They establish some pretty tight bonds with the staff, physicians, nurses, even the front desk people who see them every day and try to greet them with a smile. And they kind of go through that very emotional journey together.
Welcome to Cancer Buzz, a podcast production of the Association of Community Cancer Centers. ACCC has designed a regular audio show to keep you informed of hot topics in cancer care delivery. Today we're looking at creative efforts to address burnout, from small changes to institution-wide programs, all aiming to foster healthy and resilient workplaces. Cancer care professionals recognize burnout associated with emotional exhaustion, depersonalization, and a low sense of personal accomplishment at work as perhaps one inevitable part of the job. But until recently, the topic was not openly discussed in cancer care. Traditionally, addressing personal symptoms of burnout has been on the individual. But today, some organizations are taking the burden off the oncology professional and seeing their own role in preventing burnout and what it does to the bottom line. Robin Hearne is Director of Cancer Services and Chronic Disease Care at the Outer Banks Hospital in North Carolina, and she leads the wellness program for the oncology staff. These are the changes she saw happening with their cancer care staff, and she and her organization decided to take action.
We do our employee engagement survey through the advisory board every 2 years, and so we have that data. But that alone wasn't the driving force. That was just one part of it. It really was more about, focusing on wellness, focusing on the health of our staff. Probably I'd say what I was noticing was that staff needed more support, and we needed to create an environment that fostered healthy strategies for coping with the challenges of the workforce today. Challenges with access issues, challenges with dealing with the financial burdens of healthcare, challenges dealing with rapidly changing clinical guidelines and rapidly changing clinical environments. And so just looking for ways to promote healthy coping and adaptation to all of this change in this environment.
At Outer Banks Hospital, staff has access to hospital integrative and lifestyle medicine programs. Through their affiliation with Vidant Health Systems, Outer Banks Hospital staff also has access to free learning seminars to address healthy living. The team runs group activities for staff to bond and grow closer to colleagues, as well as their communities. Robin told us about some of these program elements.
We have 2 providers that are boarded in lifestyle medicine, and they oversee the program, and they really focus on all of the aspects of lifestyle medicine. They work on nutrition, physical activity, sleep, stress management, healthy relationships, and connectedness. And spirituality is woven into that as well in terms of connectedness. There are different strategies, I think she calls them prescriptions, that she provides to any of her clients in terms of how to grow in those areas. We focus on all of those areas in different ways. Like our catering for our events and programs, we try to focus on healthy, nutritious meals, emphasis on plant-based or primarily plant-based, but not necessarily all vegetarian. But our outreach program does a lot in the community, so our staff have participated in a lot of activities, and there have been races that people have participated in this spring. There was a Couch to 5K. Everybody didn't run, some people just walked, but that was fine just to get everyone out and doing it together. We have a group right now that are all taking tennis lessons together on Saturday mornings. We had a patient who owns a local farm, and a group of us went out strawberry picking one Saturday morning. And again, it was just a good opportunity to get people out and together, and it happened to support one of our patients as well.
The Outer Banks Hospital and Vidant Health are examples of how leadership can prioritize staff well-being. but many programs still have yet to do so. In the 2018 ACCC Trending Now in Cancer Care survey, nearly 60% of respondents reported feeling a great deal of job-related stress, and 1/3 reported feeling burnt out. 40% said they did not believe staff wellness is a part of their organization's strategic framework. According to Tom Gallo, addressing burnout needs to be led from the top down.
I think it needs to be absolutely an organizational directive. It needs to be a priority in the organization. And that's something that people have not, allocated resources to in the past. Now that is changing. People are starting to create positions of chief wellness officer, things of that nature, to try to chief experience officer, to try to deal with some of these issues from a systematic basis. Really, I think it involves setting it as a corporate priority and then funding that priority, making sure that there is funding beyond that priority, whether it's in terms of administrative resources to help create programs, or whether it's to fund the programs themselves. There needs to be money allocated to this. And I do think that organizations will see a return on investment by doing that. They'll see reduced turnover in the organization, which is huge. Organizational turnover, employee turnover costs a lot of money to every organization. So if you can reduce that, it's fantastic. But then, again, if your employee base is highly functioning, then you're going to have better outcomes for the patients and better patient satisfaction. So there is a return on investment to this.
Julie Oehlert is the Chief Experience Officer at Vidant Health in North Carolina. She spoke with us about Vidant's wellness strategy, and she says we shouldn't think of wellness as a program, but a change in mindset. Here's that interview. Why do you think Vidant's wellness strategy stands out?
We talk a lot about relationships at Vidant. We put a high value on the structure and quality and love and empathy and caring that's attached to a relationship. When you stop looking at tactical strategies and start focusing on relationships, that's where the magic happens. Because once people understand that it's their relationships that bring them joy with the patient, with the team member, with the physician, with the EVS worker, whomever, it's those relationships that help us be resilient. It's the love within those relationships that gets to all the other work. And once an organization understands that and an executive team understands that, then they begin to innovate and recreate and also tear down things that haven't worked for us. And so we spent about a year tearing stuff up, getting rid of stuff that wasn't working, that was harming relationships. And then we just started talking about, hey, why don't we just design from an intention of love? Why don't we focus on empathy? And now our results in quality, experience, safety, they're all improving. And they're improving because we focus on love and empathy. Isn't that crazy and fun and joyful at the same time?
Were you involved in any way in the creation of the wellness program at Vidant?
So I want to shift our thinking a little bit away from it being a program. If you really believe that wellness of your team members is foundational to all other outcomes, which is what we do, then it can't be a program that's siloed. It has to be an organizational strategy. So we work on wellness in a variety of venues. So our leadership development includes wellness. Our engagement survey, we ask about wellness. Our risk group and our HR group works on workplace safety, including bullying, lateral violence, bias, all of those things. Office of Experience does work on empathy and gratitude. I really want us to expand from thinking about wellness as here's this little program, I'm going to set it down, to it being really an organizational strategy.
So tell me, how long have you been in this role, and then what does a chief experience officer do? What do you do on a daily basis?
Okay, so I've been in this role for 3 years. This is the third role I've had as a chief experience officer. and they've all been a little different at different organizations, different health systems. But here, I'm strategically responsible for the patient experience, team member experience, equity and inclusion, and workplace well-being for the system. Now, I also have operational roles in EVS and food service and interpreter service because those things flow into patient and team member experience, obviously in equity and inclusion. And I would say that in the role I have at Vidant, I'm not the singular person that works on wellness. We have HR leadership that works on wellness. We have risk that works on wellness. We have executives that have wellness tucked up under their work. We have EAP. So again, really starting to have a holistic view of wellness versus a program.
So there are really two schools of thought, right, in terms of healthcare and cancer care staff burnout. Talk to us about those. Traditionally, how has burnout been addressed?
Well, and I think people go at it in a way that doesn't see it for what it is, which is what happens to an individual. So you can think about burnout as being something that is in the individual. So if I just work out more or eat better, I will not be burned out. And then you can look at it the other way and think about external forces. So is it the electronic health record that burns me out? Is it short staffing that burns me out? And I know that this would help simplify solutions if we just looked at it in one of those two schools. But what I would invite us to consider is that burnout can become very personal to the person who experiences it. It's a wicked problem, and it will require healthcare to have a variety of individualized, personalized solutions. One size does not fit all when it comes to burnout.
Give us some indicators of an unhealthy workplace. What are some of the signs of burnout?
So I can tell you what I look for when I look at organizational data. One of the big things I look at is the team member engagement results. And there are questions that most people have within their team member engagement survey that will give them an indication that people aren't doing well at their job. I have a manageable workload. My manager helps me balance job and personal life. There's questions like that. We also do a burnout survey, so many organizations do that. That's very strong indicators, a lot of data there. I also look at turnover. Organizations who have a lot of turnover in certain areas, that seems a red flag for me. I also look at things like incidents of reported lateral violence, bullying, bias, microaggressions. And then, of course, you can also see this work as it flows to the patient. Because one of the things I think is very relevant right now in healthcare is that you won't have great patient experiences unless you have safe, kind, loving team member experiences. So if I look at our data from our patients, our patient experience surveys, our grievances, our patient compliments and comments, if I see issues that are about people not caring, about relationships that haven't been therapeutic for the patient complains that people haven't spent time with them or treated them unkindly. That also shows me that those relationships and that unit, again, that bigger even organization, isn't having the level of empathy that is required to work in healthcare today. And the unfortunate outcome of burnout is we lose our empathy, which is probably our most important resource when we work right now in a complex healthcare system.
So you have your indicators, you have your survey results, you have some data that you're looking at. What can someone present to leadership to get them to understand that wellness and resiliency is up to the organization, not the individual staff person? And those services are not privileges or perks, but they're actually critically necessary for patient treatment and the success of a cancer program.
That is just such a thoughtful question, and people generally ask me that all the time. I'm going to quote a great man that I worked with. He was a dean of a medical school, and he used to say to his team, if you can't do things for the right reasons, than do it for the return on investment. And so there is humanness involved in this work, that we understand that the humans that take care of the humans we're responsible for have to have enough resilience, empathy, and their own space of kindness and caring to do the work. If that's not enough, then we can look at what turnover costs a healthcare organization, what it costs when a physician leaves within 5 years of his practice. We can look at what it costs us to have people on FMLA or off work for emotional stress. We can look at the PTSD of a team member who was verbally attacked by another team member. All of those things have costs associated with them. And I think we could go on and on and on and look for those costs. What I'm going to say is that until healthcare organizations at the very strategic level understand the reality of it, probably any return on investment to an organization who's not thinking maturely like that probably would fall on deaf ears.
I'd like to switch now to the particulars of the strategy that you run. Can you describe the different elements of your wellness strategy?
It lives in a lot of different areas. And so one of the places that it lives is in a grouping called workplace well-being, where we look at the relationships that people have. And again, I think that this is not something that people immediately think about, but burnout is what happens when team members aren't kind to each other, when it's too hard to do your job for a variety of reasons. So we have a whole system strategy around making sure that we don't have incidents of bullying, lateral violence, microaggressions, physical violence, and that we take care of team members and patients in that space. So we have a reporting structure for team members to report those incidents. We have a way we assess patients for potential violence to keep our team members safe. And then we have an aftercare response that's called caring for the caregiver, where if you've been emotionally harmed at work or a patient has harmed you, that we have a response from EAP. And so that's one piece of this work. The other piece of this work is the educational piece. So within our leadership development program, we have your own ability to be resilient, be mindful, and then your ability to lead in that space. So we talk to our leaders and teach our leaders the capacities they need in order to be a leader who can lead for wellness. Things like optimism, things like empathy, things like mindfulness. So we actually have capacities that we teach our leaders. We have team member programs, a variety of team member programs, if team members are interested in learning more about gratitude, more about mindfulness, more about empathy. So we explore those concepts in an educational forum. And then we have the physical wellness piece. So we have 3 wellness centers across our health system that at a very discounted rate team members can go, and we have health coaches there for them. We have dietitians there for them. We have the ability to take swimming lessons for them, group exercise, yoga. So we kind of have it couched in those elements. And then the last piece, I think, which is maybe the most heartfelt for me, is we have team members who also have issues with social determinants of health. They might not have the ability to have good food. They might not have support structures at home. So our next kind of endeavor is really reaching into our team member base and saying, are there other issues that are stopping you from being your best self at work? And can we address those just like we address social determinants of health with our patients?
So when you're talking with your team members about social deterrents of health, are those in one-on-one conversations or are they part of a bigger group presentation?
So once a year, our team members all have a bioassessment. So they come to our occupational health and they get their blood sugar checked and they get their weight checked. And at that time, we can explore with them if there are other issues that are contributing to their ability to be physically well. And so we talk about it there. We also ask our team members about food scarcity. We ask that in a survey methodology that is blinded because we realize that people might not be comfortable, just like our patients aren't comfortable in talking about those social determinants of health. And that just gives us an idea organizationally of what we're dealing with. And I would say that this is the newest area of our wellness. I think what you're hearing me talk about is unsiloing the patient experience and the team member experience. So if we're doing things for patients, we also have to do them for the team members. If we're doing things for team members, we also do them for patients. And what that does is that creates that really, we hope, that really bonded culture. When we started thinking about social determinants of health for patients and how stressed patients are when they don't have transportation and they don't have support at home, we immediately had to say, well, then what about our team members? Because our team members have the same lives as some of our patients.
For the voluntary group programs that you put forth, the physical wellness piece and the emotional wellness piece, how's participation for those voluntary ones? How was it in the beginning? Did everyone jump in to try it out, or did you see participation increase over time? And then how do you let your staff know that those services are available to them?
To answer the first question, the participation continues to improve. And one of the things we did this year is we dropped the price of our wellness centers. We dropped the price significantly, and because we wanted more participation, and we saw several hundred more team members that said, oh, at that price, and we take it out of their check, it's easy. At that price, I can go. So we watch those things because we have the wellness centers for them. So if the price is not at their price point, then that's on us. So we see more and more team members beginning to be involved, especially when we started training and creating awareness around things like mindfulness and resilience and having a safe place. Then people started talking about it, and if our leaders could lead for it. So we've seen increased participation. One of the things that I'm most fascinated about right now at Vidant is we do a series of salons, and those are 55-minute interactive, facilitated small groups that talk about things that are relevant to our cultural wellness. We have one on empathy, we have one on gratitude, and we have one on equity and inclusion. And those are only by attraction. So only through word of mouth. You can go in the Learn Center and sign up, but we don't mandate them. They're what we call through attraction. And so far, since we started these kind of what we call holistic exploratory salons, we've had almost 3,000 team members come to Empathy Salon. We've had almost 1,000 come to Gratitude Salon, and our third and final salon on equity and inclusion is already almost at 500. Wellness isn't in a silo, right? We know that people need empathy, that gratitude helps people be well and resilient. We know that equity and inclusion is all about the team experience and the patient experience. And so we see as we offer things and we create good word of mouth around them, that people tend to show up.
So what differences have you seen this shift in your strategy make in the short term and the long term in your cancer care program?
First of all, when you have a strategy of wellness that has as many facets and is as holistic as ours, there's more openness to conversations about it and more openness to try things, because nobody's afraid to try things because we're talking about it all the time. I would say our continued growth in our wellness program to look at offering integrative therapies, which all cancer programs do, but doing them for team members as well. We have a medical director of the Office of Experience who also works with our cancer center. And so she is a physician who does integrative medicine and has her own integrative practice. She became the medical director of the Office of Experience, and I think she's probably one of the only medical directors for a chief experience officer for Office of Experience. And she works with our cancer center to integrate all these things that we're talking about, not just for the patients, but for the wellness of the team member. Because to be honest with you, taking care of cancer patients can be very, very sad and rewarding and stressful all at the same time. And so our focus on those team members is just as important, if not more important, as what we're doing with the patients.
Have you noticed any improvement in that patient experience, patient-staff interaction since you shifted strategy? And then what about staff-to-staff interaction?
So interestingly enough, our team engagement, which is a really standard measure, right? I mean, everybody measures their engagement results, has continued to go up measurement after measurement, year after year. We just got our engagement results back like 2 weeks ago. And again, every entity in the organization has moved up. And some of the strengths in that engagement survey is manager effectiveness, because we work a lot with leaders to be able to lead. And so looking at the manager effectiveness that went way up, remember we have people lead for it, and also the incidence of my manager helps me learn new skills, my manager helps me balance my job and work life. So all of those improved, which I think speaks to the strategy. And then the other thing that I watch is the patient complaints. Patient grievances are heavily regulated, and we watch the tone and the context of how did those relationships get broken that patient felt like they had to call. And I see the incidence of grievances of patients calling decreasing, and I see the tone of those changing as people begin to value that relationship more than they had in the past, related to how they relate to their own work environment.
So what's in store for the future in terms of a wellness strategy at Vidant?
So we're pretty excited about our holistic wellness strategy. So for us next year, it's continuing to work on team member engagement with a laser focus, because we believe that the engagement of our team members and our physicians drives all other outcomes. So laser focus, continuous focus there. Thinking about doing more with equity and inclusion. I live in North Carolina, and we know that being equitable and being inclusive impacts our ability to be resilient and be joyful at work. So a big focus on equity and inclusion next year, a focus on stay interviews so our team members know we care about them and we're developing them. I think that's really, really valuable. And then lastly, really focusing on making sure that our environments are safe. Healthcare workers have 8 times greater potential to being physically harmed at work. And we know that that creates stress for our nurses, physicians, our care providers, everyone. So we have a very big focus right now on creating a safe environment for our team members, psychologically safe and physically safe. And then if something does happen, what is our response? And implementing that care for the caregiver program and being able to reach out to people who have not had a good experience and helping them work through it and learning from it. So those are our big, big focuses going into fiscal year 2020.
Finally, what advice would you give to someone who wants to implement a staff well-being initiative in their own program or their own facility, but they don't know where to start?
I would say pull the research that connects the team member wellness to the patient experience. Many healthcare organizations are very focused on the patient experience. We now have survey methodology that ties it to our reimbursement, but that connection redirects us to where do those resources need to go. Because if you're focusing on joy at work and workplace well-being, the output and the indicator for whether you're doing great with that is going to be through the patient experience. I think sometimes healthcare organizations have worked on the patient experience at the cost of their workplace well-being with their team members. So my very first recommendation would be to get to the literature and see how team member engagement influences safety, quality, turnover, and then start there and focus your efforts on that root cause, and then see all your other outcomes improve.
We'd like to thank Tom Gallo, Robin Hearne, and Julie Oehlert for being part of our conversation today. To find more research on burnout prevalent and more articles from our 3 guests, you can find show notes for this episode at accc-cancer.org/podcast. Next time on Cancer Buzz, we will look at treating the whole patient, comprehensive cancer care services, and value-based payment models. Thank you for listening. If you like the show, please share it with your colleagues. Until then, for the Cancer Buzz team, I'm Summer Johnson.